Hi, Mr. A. This is my sheep heart, and I am Jan Wells. And first of all, I'm going to show you some outside features of my sheep heart. This is the ventral side, and right here is the right atrium. Over here is the left atrium. The left pulmonary artery is this piece right up in here. And if it was a little bit longer, there would be branches from it, and I will show you the opening in a minute. And this is the right ventricle right here, and the left ventricle is over on this side. Now the coronary sulcus is right along here, and in that coronary sulcus is the right coronary artery, and then along here, which is the anterior interventricular sulcus, is the great cardiac vein as well as the anterior interventricular artery. Now when I turn it over to the dorsal view, and remember this will be the right side, here is the aorta, and the aortic arch, which I don't really have much of, would be an extension of that. The superior vena cava come in right here. The inferior vena cava is right here, and they empty into the right atrium. Then the branches of the right pulmonary vein, the main pulmonary vein, is right here. And this right here is the opening for the right pulmonary artery. And right in here would be the opening for, this is the left pulmonary artery, and right in here would be for the right pulmonary artery, right there. And now I'm going to shut you off and come back when I've got it opened up. Okay, Mr. A, I did the right side. I didn't do a real good job of it, but I'll try and show you some things that I found. The aortic semilunar valve that I pretty much destroyed, I think is right here. Right here, the way it was shaped. I can't find the pulmonary semilunar valve. I think I destroyed that. This would be the inside of the right atrium, and here's the inside of the right ventricle. The coronary sinus would be, there are two kind of little holes back in here, and they would be inside the right ventricle in there. The tricuspid valve is right here, separating the atria with the right ventricle. The right atrioventricular canal is the little canal connecting the two, and the papillary muscles are, if I hadn't destroyed them, would be holding the valve, and that's what keeps the valve open and shut. When they're relaxed, they're open. When they're contracted, it is shut. So that is my right side. I'm going to show you some chordae tendae while I have it open in case I destroy the left side. And right here are several of the chordae tendae. I'm probably into the left ventricle over here as well. I'm going to cut open and look into the left atrium. But these would be the chordae tendon, and they might be holding the, I don't know what they're holding. I can't tell from my desperate attempt to dissect this. But the chordae tendae would come in and be connected to the papillary muscles, which would help regulate the opening and closing of the valves. So I'm going to shut you off again. I'm going to attempt to dissect my left side and see what I can come up with. Okay, Mr. A, this is my left side, and I have pretty much destroyed my sheep heart. But this would be the left atrium up here. Here would be the left ventricle. Right in here, I think, is the bicuspid valve. I can identify the chordae tendae and the papillary muscles that connect to it. I was having a hard time looking for the semilunar pulmonary and aortic valves. I think I found the aortic valve, but I couldn't find the pulmonary valve, so I'm going to look in the textbooks. I had a really hard time with this dissection because I had a hard time interpreting the book, but I did see all the things that we talked about, and I did attempt it, and a surgeon I will never, ever be.